Seniors, your blood pressure is fake high because of this one mistake. Fix it today. It's a disconcerting realization, but the number you see on your blood pressure monitor might not be telling the whole truth. In fact, it could be drastically inaccurate, potentially leading you down a path of unnecessary medication or, conversely, a dangerous delay in essential treatment. This isn't a critique of modern medical equipment or the dedication of your healthcare providers. The issue often lies with a single, remarkably common oversight that occurs right before the reading is taken. This subtle error, performed by an estimated 70% of individuals without conscious awareness, has the power to inflate your readings by as much as 20, 30, or even 40 points, transforming a perfectly normal blood pressure into one that appears alarmingly high. As a cardiac surgeon with over 2 decades of experience, I've witnessed firsthand the detrimental consequences of overtreating blood pressure that isn't truly elevated. The resulting side effects can range from unsettling dizziness and loss of balance to severe falls, fractures, and prolonged hospitalizations, all stemming from what I call fake high blood pressure readings. However, the danger doesn't end there. On the flip side, ignoring genuine hypertension because one dismisses every elevated reading as fake can lead to equally catastrophic outcomes: strokes, heart attacks, and kidney failure. Both scenarios present significant risks, and the critical difference between them hinges on one fundamental ability: discerning when a blood pressure reading is authentic and when it is artificially inflated or deflated. By the conclusion of this discussion, you will possess the knowledge to identify the precise mistake that causes misleading blood pressure readings, understand how to verify the legitimacy of any high readings you encounter, and most importantly, gain the tools to ensure you are never again subjected to inappropriate medical interventions, whether it's unnecessary medication or a critical lack of it. This is not mere conjecture. It's vital, life-saving information that can prevent you from taking medications you don't need or missing those you desperately do. To illustrate the gravity of this issue, let me introduce you to Robert, a man whose experience, tragically, is not unique. Thousands are currently in a similar predicament, unaware of the silent danger until it's too late. Robert, a vibrant 71-year-old who felt in excellent health, attended his routine annual checkup with confidence. During his visit, a nurse recorded his blood pressure at 158/94. Robert was taken aback. He felt perfectly fine, experiencing no symptoms. A second reading was taken, yielding an even higher 162/96. His physician, reviewing these numbers, informed Robert that his blood pressure was too high and medication was necessary. Robert, still feeling well, expressed his confusion and asked for another check. The nurse obliged, taking a third reading, 156/92. All readings indicated high blood pressure. Consequently, his doctor prescribed amlodipine, 5 milligrams daily, with instructions for a follow-up in 1 month. Within 3 days of starting the medication, Robert noticed a change. Instead of improvement, he experienced a pervasive dizziness upon standing and a disconcerting fogginess in his head, as if moving through thick water. He contacted his doctor, and the nurse, attributing these symptoms to common side effects, advised him to give it 2 weeks, suggesting they would likely subside. Robert complied, but the dizziness did not abate. It intensified, leaving him feeling unsteady and uncertain. He began relying on a cane for excursions. His confidence in his balance eroded. 1 month later, Robert returned for his follow-up appointment. His blood pressure was measured at 148/88. While slightly improved, it was still deemed high, prompting his doctor to suggest an increase in his dosage to 10 milligrams daily. Robert reiterated his ongoing dizziness, to which his doctor responded that while unfortunate, controlling his blood pressure was paramount, and dizziness was a preferable alternative to a stroke. Robert increased his medication to 10 milligrams, and the dizziness escalated to a severe degree. He felt disoriented, struggled with clear thinking, and began to withdraw from social activities, deeming driving unsafe. His wife assumed responsibility for all errands, and Robert, once independent and active, found himself housebound due to the debilitating dizziness caused by his blood pressure medication. 3 months into his treatment, while descending his familiar front stairs, a sudden wave of dizziness struck him. He missed a step, lost his balance, and tumbled down 8 stairs, sustaining a significant head injury upon impact with the concrete landing. His wife discovered him unconscious, bleeding profusely. The aftermath was dire. A skull fracture, subdural hematoma, and intracranial bleeding necessitated emergency surgery. He spent 3 weeks in the hospital, followed by 2 months of intensive rehabilitation. He survived, but he was irrevocably changed, grappling with persistent memory and balance issues, all a direct consequence of a fall triggered by medication-induced dizziness. The true tragedy, and what should evoke a strong sense of frustration, is that Robert's blood pressure was never actually high. The readings that initiated this cascade of negative events were artificially inflated. They were fake high. The erroneous readings at the doctor's office were not due to a faulty monitor or imprecise technique. Instead, they were elevated due to a singular, simple mistake Robert was making consistently, a mistake that added an astonishing 30 to 40 points to his systolic readings. This single error transformed his normal blood pressure into one that appeared dangerously high, and crucially, this discrepancy went unnoticed by his medical team, who simply acted upon the numbers presented. Following his fall, his hospitalization, and his surgery, Robert's daughter sought my expertise for a comprehensive cardiac evaluation. My assessment revealed a healthy heart, but upon correctly measuring Robert's blood pressure, meticulously avoiding the common error, I discovered his true reading to be 118/76, perfectly normal. Robert had never needed blood pressure medication, not a milligram of it. His elevated readings were a fabrication, a fake high that cost him his independence, impaired his cognitive function, and nearly cost him his life. The mistake itself is deceptively simple, and I will reveal it shortly. However, understanding why this matters so profoundly, why accurate blood pressure measurement is a matter of life and death, is crucial. This single mistake can devastate lives in 2 distinct ways. Robert's story exemplifies the peril of overtreatment, where unneeded medications lead to life-altering side effects. Conversely, the path of undertreatment, equally perilous, is illustrated by the case of Margaret. At 73 years old, Margaret's routine doctor's visit revealed a blood pressure of 142/88, which was considered elevated. Her doctor recommended medication, but Margaret, having researched the potential side effects, was hesitant. She had heard that readings taken in a clinical setting are often artificially high due to white coat syndrome. She proposed to monitor her pressure at home, agreeing to medication only if her readings remained high in a familiar environment. Her doctor found this a reasonable approach. Margaret acquired a home blood pressure monitor and began checking her pressure that evening, recording 128/78 normal. The following morning, she recorded 132/82, also normal. Over the course of a week, her readings consistently fell between 125 and 135 systolic, never exceeding 135 in her diastolic readings. Upon reporting these findings to her doctor, she felt vindicated, believing her initial elevated reading was indeed a result of nervousness. Her doctor reviewed her home log, acknowledging the improved numbers and suggesting weekly home monitoring with a follow-up in 3 months. Margaret continued her weekly checks, all showing within the normal range, reinforcing her belief that she did not require medication. 6 months later, while preparing dinner, Margaret experienced a sudden, alarming sensation. Her right hand went numb, causing her to drop a knife. When she attempted to speak to her husband, her words emerged garbled, unintelligible sounds rather than coherent speech. Her husband rushed into the kitchen, observed the drooping on the right side of her face, and immediately recognized the signs of a stroke. He called 911. By the time the ambulance arrived, Margaret was paralyzed on her right side, unable to speak, and incapable of understanding spoken language. At the hospital, a CT scan confirmed a massive ischemic stroke, affecting a significant portion of her left cerebral artery territory. Despite receiving clot-busting medication, it was too late to prevent substantial damage. Margaret survived, but her recovery was incomplete. She lost the use of her right arm, requires assistance to walk, struggles with speech, and necessitates full-time care. At 73, the stroke had irrevocably stolen her independence. The reason for this devastating outcome? Margaret's blood pressure was not fake high. It was genuinely elevated. However, her home readings were artificially fake low. She was inadvertently committing the same fundamental error as Robert, but in reverse. This mistake made her genuinely high blood pressure appear normal in the comfort of her home, leading her to believe she was fine and medication was unnecessary. This misjudgment came at a profound cost. So, what precisely is this pervasive mistake? It's the very same error that can elevate blood pressure readings to appear falsely high, as in Robert's case, or falsely low, as in Margaret's, affecting millions of blood pressure measurements daily. This is not an obvious error, nor is it something commonly disclosed by healthcare professionals. It is so elementary and widespread that a significant majority of people commit it without giving it a second thought. The culprit is arm position. The placement of your arm during a blood pressure reading can alter the measurement by 20 to 40 points, and sometimes even more. For an accurate reading, your arm must be positioned precisely at heart level. If your arm hangs below heart level, gravity exerts additional pressure, inflating the reading. Conversely, if your arm is elevated above heart level, gravity assists in reducing the pressure, leading to a lower reading. Even a few inches of discrepancy can have a substantial impact. To understand the physics involved, blood pressure is the force exerted by circulating blood against the walls of your arteries, measured in millimeters of mercury, mmHg. Each mmHg represents the pressure required to lift a column of mercury 1 millimeter against the force of gravity. When your arm is at rest by your side, below heart level, gravity draws blood downwards into your arm, increasing the pressure at the measurement site. The lower your arm, the higher the resulting reading. For instance, if your arm is 10 inches below heart level, it can add approximately 8 mmHg to your reading, and at 20 inches below, it can add around 16 mmHg. Consider the typical blood pressure measurement scenario in a doctor's office. You are seated on an examination table, your arm resting at your side or on your lap. The cuff is placed around your bicep and the reading is taken. In this common posture, your arm is likely 8 to 12 inches below heart level. This position alone can add an estimated 8 to 12 points or more to your systolic reading. Therefore, a true blood pressure of, say, 128 might be recorded as 140, a fake high reading. Robert's blood pressure measurements at his doctor's office, 158/94, 162/96, and 156/92, were all taken with his arm hanging passively at his side. Each of these readings was artificially elevated. His actual blood pressure, when measured correctly with his arm at heart level, was a healthy 118/76. The difference between his fake and real reading was a staggering 40 points in systolic pressure. The difference between normal blood pressure and stage 2 hypertension, the difference between requiring no medication and being prescribed high-dose medication, all due to the simple misplacement of his. Now let's look at Margaret's home readings. She was seated on her couch, cuff on her arm, resting on the armrest. This armrest was slightly higher than her heart, placing her arm about 4 to 6 inches above heart level. This elevated position would subtract an estimated 6 to 8 points from her reading. Her actual blood pressure was a genuinely high 152/92, indicating stage 2 hypertension and a significant stroke risk. However, with her arm above heart level, it was recorded as 132/82, a fake low reading. This led her to believe she was fine, when in reality she was at considerable risk. This, then, is the critical mistake: arm position. And it is pervasive, occurring in countless doctors' offices, homes, and pharmacies. The vast majority of blood pressure readings are rendered inaccurate because the arm is not positioned correctly. This leads to medical decisions being made based on flawed data, a silent but potentially devastating form of diagnostic error. Let me introduce Helen, whose situation highlights how this primary mistake can interact with other factors to create a cascade of confusion and potential harm. At 68 years old, Helen was diagnosed with high blood pressure and commenced medication. However, she experienced adverse effects, including fatigue, weakness, and dizziness. To determine if the medication was truly necessary, she decided to monitor her pressure at home. She purchased a reputable Omron monitor and established a routine. Sitting at her kitchen table, placing the cuff on her left arm and resting her arm on the table. Her readings were consistently normal, around 118/74, confusing her as it contrasted with her doctor's diagnosis. She checked daily for a week at the same table, always obtaining normal readings. She presented this log to her doctor, who, while skeptical, checked her blood pressure in his office with her arm hanging at her side, yielding a high reading of 152/88, followed by 148/86. He dismissed her home readings, suggesting a faulty monitor and insisting she continue her medication. Helen was caught in a dilemma, unsure which readings were accurate. Seeking a second opinion, Helen consulted me. In my office, I had her sit in a chair with armrests, placing the cuff on her left arm and ensuring it rested on the armrest at precise heart level. The reading was 146/86, high. Then I had her drop her arm to her side, resulting in a much higher reading of 164/94. Finally, with her arm elevated on a higher surface, the reading dropped to 128/78. Within minutes, the same individual produced 3 vastly different readings, a systolic spread of 64 points, all due to variations in arm position. I explained to Helen that her doctor's office reading was likely fake high due to her arm hanging too low, while her home readings were fake low because her arm was resting on an elevated table. Her actual blood pressure, measured correctly with her arm at heart level, was 146/86, genuinely elevated and necessitating treatment. This demonstrates that the discrepancy isn't solely about whether blood pressure is high or low, but about obtaining the actual pressure to guide treatment decisions. Too many individuals, like Robert, are overtreated based on falsely high readings, suffering from unnecessary medication side effects. Conversely, many, like Margaret, are undertreated due to falsely low readings, leading to strokes because they mistakenly believe their pressure is normal. The root cause in both instances is arm position. Therefore, the crucial question becomes, how does one correctly measure blood pressure? Here is the precise protocol, every step of which is vital for obtaining meaningful numbers. If you intend to check your blood pressure, doing so incorrectly renders the readings meaningless. Begin by sitting in a chair that provides back support, not a stool or standing position. Ensure your back is fully against the chair's backrest, with your feet flat on the floor, not crossed or tucked beneath the chair. This posture promotes proper blood flow and prevents venous congestion. Crucially, you must rest for 5 full minutes before taking any reading. During this time, avoid talking, looking at your phone, or engaging in stressful thoughts. Simply sit quietly, breathing normally, allowing your body to settle. Blood pressure fluctuates constantly, and factors like movement, talking, or stress can temporarily elevate it. Achieving a baseline is essential, and 5 minutes of quiet rest is the key. Next, wrap the cuff snugly around your bare upper arm, ensuring it is not placed over clothing, which can add bulk and affect the reading. The cuff should be snug but not constricting. You should be able to slip 2 fingers between the cuff and your arm. The bottom edge of the cuff must be positioned 1 inch above your elbow crease, ensuring it correctly encases the brachial artery. Now, here lies the most critical element. Rest your arm on a surface at precisely heart level. Not near it, but exactly at heart level. Your heart is generally located at the mid-sternum, approximately the middle of your chest. Align the middle of your upper arm where the cuff's measurement is taken with this same level. Use pillows, stacked books, or any suitable means to achieve this precise elevation. How can you confirm it's correct? The middle of your upper arm, where the cuff is, should be level with the middle of your chest. If you are using a table, its height must be adjusted accordingly. Many kitchen tables are too low, causing your arm to fall below heart level. Dining room tables are often better, or a pillow on your lap can help elevate your arm. The core principle is achieving exact heart level positioning. Once your arm is correctly positioned, take the reading. Do not talk, move, or alter your breathing pattern. The monitor will inflate the cuff and then slowly deflate it. Wait for the numbers to appear. Record them. Then wait for 2 minutes and take a second reading, ensuring the arm remains in the identical position. Record this second number. Finally, take a third reading, again in the same manner, and record it. Average the 3 readings. This average represents your blood pressure, not the result of the first reading alone. The first reading is often artificially elevated due to anticipation or mild anxiety. The second and third readings tend to be lower and more representative of your actual pressure. Averaging these three provides the most reliable measurement, mirroring the methodology used in research studies and the standard you should adopt. To further illustrate the impact of correct versus incorrect technique, let me tell you about Thomas, a 76-year-old gentleman. His doctor had diagnosed him with high blood pressure and prescribed medication. Thomas, however, wished to monitor his pressure at home. He acquired a monitor and began taking daily readings. His routine involved sitting on his couch, wrapping the cuff around his arm, resting it on the couch armrest, and taking a single reading, which he would then record. Thomas consistently observed that his home readings were lower than those taken at his doctor's office. His office readings ranged from 158 to 168, while his home readings were between 128 and 138. He concluded that his doctor's office readings were exaggerated by white coat syndrome and that his home readings reflected his true, near-normal blood pressure. He felt reassured that the medication was effective. However, Thomas was unknowingly making two critical errors. Firstly, the couch armrest he used was slightly elevated, placing his arm above heart level during his home measurements. This positional error caused his readings to be artificially low by approximately 6 to 8 points. Secondly, he was only taking a single reading, neglecting the crucial step of averaging 3 measurements, making that single reading inherently unreliable. Thomas sought my consultation due to persistent headaches. My examination revealed no other underlying issues, but his blood pressure was significantly elevated. When measured correctly in my office, with his arm at heart level and an average of 3 readings, his blood pressure was 164/96, considerably higher than his home readings suggested. I asked Thomas to demonstrate his home measurement technique. I observed his use of the elevated armrest and his single reading approach. I explained the implications of these errors. We then performed the measurement correctly in my examination chair, with his arm at heart level, adjusting the armrest to match his mid-chest. After the mandated 5-minute rest, we took 3 readings, 2 minutes apart, 162/94, 168/98, and 164/96. The average was 165/96. Thomas was astonished. His actual blood pressure was much higher than his home readings indicated. He required an adjustment to his medication, and his headaches subsequently resolved as his blood pressure came under control at 132/82. This case underscores the indispensable role of correct measurement technique in identifying and managing hypertension. It is imperative to grasp that blood pressure measurement is far from a casual endeavor. It demands precision and attention to detail. Every element carries weight. While arm position is the most significant factor, numerous other elements contribute to the accuracy of a reading. These include whether you are sitting or standing, whether your back is supported or unsupported, whether your legs are crossed or uncrossed, the size of the cuff, its precise placement, whether you are talking or remaining silent, recent physical activity, and recent consumption of caffeine or nicotine. Each of these variables can influence the reading. Let us delve into these additional factors, recognizing that while arm position is paramount, other elements are also significant. Caffeine, for instance, can temporarily elevate blood pressure by approximately 5 to 10 points for a period of 1 to 3 hours after consumption. Checking your blood pressure within 20 minutes of drinking coffee will likely result in an artificially inflated reading. To obtain an accurate baseline, it is advisable to avoid caffeine for at least 30 minutes before checking, and ideally for an hour. Smoking exerts a similar effect. Nicotine induces immediate vasoconstriction, causing blood vessels to narrow and blood pressure to spike, often by 10 to 15 points within minutes. This elevation can persist for up to 30 minutes. Therefore, if you smoke and immediately measure your blood pressure, you are likely to get a fake high reading. A waiting period of at least 30 minutes after smoking is recommended. Exercise, too, elevates blood pressure during and immediately after physical exertion. This elevation can linger for 30 to 60 minutes. For example, walking briskly up a flight of stairs and immediately checking your blood pressure will yield a high reading, but this reflects post-exercise pressure, not your resting baseline. A minimum rest period of 30 minutes and preferably an hour is necessary after significant physical activity before taking a measurement. A full bladder can also significantly impact blood pressure readings, potentially increasing them by approximately 10 to 15 points. The discomfort associated with a full bladder can cause a physiological response that raises blood pressure. If you need to urinate and check your blood pressure beforehand, the reading will be artificially elevated. It is best to empty your bladder before taking a measurement, a seemingly minor step that can make a substantial difference. Talking, even casual conversation, can raise blood pressure by 6 to 10 points. Therefore, your blood pressure while speaking is not indicative of your resting state. It is crucial to remain silent during the measurement process, and ideally for the 5 minutes of rest preceding it. No talking should occur until you have completed all readings. Lack of back support can also lead to elevated readings. If you are seated on a stool or perched on the edge of a chair without your back resting against anything, your muscles are engaged in maintaining posture, which can increase blood pressure by approximately 5 to 10 points. A fully supported seated position, with your back against the chair's backrest and relaxed, is essential for accurate readings. Crossing your legs can elevate blood pressure by 2 to 8 points. This posture compresses blood vessels, increasing resistance and consequently raising pressure. Your legs should be uncrossed with your feet flat on the floor to allow for optimal blood flow and accurate measurements. Cuff size is another critical factor. If the cuff is too small for your arm, the reading will be artificially high. It is imperative that the cuff fits your arm correctly. Most standard monitors come with a cuff designed for arm circumferences of 9 to 13 inches. If your arm is larger, you will need a large cuff. Using a small cuff on a larger arm can add 5 to 15 points to the reading. Therefore, measuring your arm circumference and obtaining the appropriate cuff size is vital. Finally, the time of day at which you check your blood pressure matters. Blood pressure follows a circadian rhythm, being lowest during sleep, rising in the morning, peaking in the late afternoon, and declining in the evening. A reading taken at 6 a.m. will naturally differ from one taken at 6 p.m., possibly by 10 to 20 points. This variation is normal. For consistency, it is recommended to check your blood pressure at the same time each day. The morning, before breakfast, and before taking any medications, is generally considered the optimal time, allowing your body to adjust to being upright and providing the most comparable readings day to day. Let us consider Patricia's case, which powerfully illustrates how the cumulative effect of these various factors can lead to highly inaccurate readings. At 74 years old, Patricia's doctor initiated blood pressure medication due to office readings of 168/94. She decided to monitor her pressure at home and established a routine, checking every morning after waking, visiting the bathroom, making coffee, drinking it while reading news on her iPad, and then taking her blood pressure. She would sit on her dining chair, which offered minimal back support, often perching on the edge. She'd wrap the cuff around her arm and rest it on the dining table, which was notably low. This positioning meant her arm was consistently below heart level. Her single reading typically registered around 138/84. Patricia believed her blood pressure was acceptable at home, deeming 138 borderline but manageable, and considerably better than the 168 recorded at the doctor's office. She assumed her medication was functioning effectively. However, Patricia was inadvertently making several errors. She checked her pressure shortly after consuming coffee, introducing a caffeine-induced elevation. Her lack of back support while sitting on the edge of the chair contributed to muscle tension and an elevated reading. Furthermore, her arm being positioned below heart level on the low table artificially increased her reading. While she was checking in the morning, an optimal time, the combination of these factors created readings that were unpredictably inaccurate, influenced by elements that both raised and potentially lowered the measurement. When Patricia underwent a correct blood pressure measurement in my office, using a proper chair with back support, feet flat on the floor, after a 5-minute rest, with no coffee consumed for 2 hours prior, and her arm positioned at exact heart level with an average of 3 readings. Her actual blood pressure was 154/88. This was higher than her home readings, but lower than her doctor's office readings. Her pressure was genuinely elevated and required medication. However, determining the correct dosage necessitated understanding her actual blood pressure, not the misleading numbers derived from her flawed technique. This scenario highlights the profound importance of technique. Every deviation from correct procedure alters the reading. Some errors inflate it, while others deflate it, leading to numbers that fail to reflect your true blood pressure. Consequently, medical decisions, whether to prescribe or withhold medication, are made based on inaccurate information. This is not intentional malpractice, but a dangerous consequence of accidentally flawed data collection. Therefore, if you are monitoring your blood pressure at home, it is imperative to follow the correct procedure meticulously, leaving no room for shortcuts. Invest in a validated blood pressure monitor, such as the Omron 7 or 10 series, which have demonstrated high accuracy when compared to mercury sphygmomanometers. Ensure you have the correct cuff size for your arm. Measure your upper arm circumference and purchase the corresponding cuff. Aim to check your blood pressure at the same time each day, preferably in the morning, before breakfast, and before taking your morning medications, allowing about an hour after waking to adjust to being upright. This consistency will yield comparable readings. Empty your bladder beforehand. Abstain from caffeine and nicotine for at least an hour prior to measurement, and avoid strenuous exercise for at least an hour before. Sit in a proper chair that offers back support, with your back fully against the backrest and your feet flat on the floor. Rest for 5 minutes in silence, without distractions like your phone or television. Place the cuff on your bare upper arm, ensuring the bottom edge is 1 inch above your elbow crease. Snug but not tight. Crucially, rest your arm on a surface positioned at exact heart level. You may need to use pillows or books to achieve this precise height, ensuring the middle of your upper arm aligns with the middle of your chest. Take 3 readings, 2 minutes apart, without talking or moving, breathing normally. Record all 3 numbers and then calculate their average. This average represents your true blood pressure. Performing this daily for a week, and then weekly thereafter, will allow you to track your numbers and identify patterns. Consistently reading below 120 systolic generally indicates you are likely fine. Readings consistently above 130 warrant a discussion with your doctor. Borderline readings between 120 and 130 require continued monitoring and a focus on lifestyle factors such as diet, exercise, and stress management. Now, consider this critical question. What if your blood pressure readings at the doctor's office are high, but your home readings are consistently normal, as was the case with Robert? Is it fake high due to white coat syndrome and incorrect technique, or is your home technique flawed? How can you definitively ascertain which reading is accurate? The most reliable method is 24-hour ambulatory blood pressure monitoring. This involves wearing a device that automatically measures your blood pressure at predetermined intervals, typically every 20 to 30 minutes throughout the day and night. This process generates 50 to 70 readings over a 24-hour period, providing an average that reflects your true blood pressure without the influence of the white coat effect or measurement technique issues. If your doctor's office readings are elevated, but your home readings appear normal, request a 24-hour ambulatory blood pressure monitoring. Insurance typically covers this when there is a discrepancy between office and home measurements. This monitoring will reveal the truth. If it shows your pressure is genuinely normal, you likely do not require medication. Conversely, if it indicates your pressure is actually high, you will need treatment, despite your seemingly normal home readings. Susan's story at 72 years old encapsulates this scenario perfectly. Her office readings were consistently high, 162/92, 168/96, and 158/90. Her doctor recommended medication, but Susan's home readings were normal, 128/78, 132/82, and 124/76. She was convinced this discrepancy was due to white coat syndrome and was reluctant to take medication based on office readings she believed were artificially inflated. I recommended 24-hour ambulatory monitoring. Susan wore the device, which took her blood pressure every 30 minutes for 24 hours. The results indicated an average blood pressure of 126/78, normal. Her home readings had been accurate, and her office readings were indeed fake high due to anxiety in a clinical setting. She did not require medication, and this was confirmed through the objective data from the 24-hour monitoring. Contrast this with another patient, James, 78 years old, whose office readings were also high, at 172/94. However, his home readings were normal at 136/82. James was adamant that his home readings were correct and his office readings were fake. We proceeded with 24-hour ambulatory monitoring. The results showed an average blood pressure of 164/90, high. His office readings were accurate, but his home readings were fake low. This was attributed to incorrect measurement technique at home, specifically issues with arm positioning. James needed medication but had been refusing it because his home readings appeared normal. This highlights the critical importance of 24-hour monitoring. It acts as the ultimate arbiter, the tiebreaker, when office and home readings diverge, revealing the undeniable reality. In conclusion, blood pressure measurement may appear straightforward. Simply wrap a cuff and press a button. But it is anything but simple. Technique is paramount, with arm position alone capable of creating 20 to 40-point differences in readings. When you factor in other variables such as caffeine consumption, talking, lack of back support, crossed legs, incorrect cuff size, and improper timing, you can easily obtain readings that bear no resemblance to your actual blood pressure. Robert's experience is a stark reminder of the dangers of overtreatment based on fake high office readings, leading to side effects, a debilitating fall, and brain injury from medication he never needed. Margaret's story illustrates the peril of undertreatment due to fake low home readings, resulting in a stroke and the loss of her independence because she falsely believed her pressure was normal. Helen was left confused and frustrated by conflicting readings, a situation compounded by a lack of proper explanation regarding technique. Thomas suffered from headaches due to uncontrolled hypertension, his home readings being misleadingly low. Patricia's multiple technique errors created unreliable readings. All these individuals faced adverse consequences due to inaccurate blood pressure measurements. Do not let this happen to you. If you are checking your blood pressure at home, commit to doing it correctly, every step of the way, with no shortcuts. The essential steps include maintaining your arm at heart level, ensuring your back is supported, keeping your feet flat, resting for 5 minutes, remaining silent, taking 3 averaged readings, and checking at the same time daily. This is not optional. It is a requirement for obtaining accurate readings. And accurate readings are the foundation for correct medical decisions. If your doctor's office readings are high, but you suspect they are fake high, your recourse is to request 24-hour ambulatory monitoring. This will definitively prove whether your pressure is truly normal, empowering you to confidently decline medication. However, if your home readings are normal and you are avoiding medication, ensure with absolute certainty that your technique is flawless. Deceptively low readings resulting from poor technique could have life-threatening consequences. Your blood pressure is undeniably important, but the number you obtain is entirely contingent upon how you measure it. Incorrect measurement leads to incorrect numbers, which in turn leads to incorrect decisions and consequently detrimental health outcomes. Conversely, accurate measurement yields accurate numbers, enabling sound decision-making and safeguarding your health. If this information has illuminated a common error impacting millions of blood pressure readings daily, please share it. Forward this to everyone you know who monitors their blood pressure. They need this vital information, as their doctors may not be adequately instructing them on correct technique. They are likely receiving inaccurate numbers and making flawed decisions as a direct result. By sharing, you can make a significant positive impact. Subscribe to this channel, as my mission is to provide you with practical, accurate health information that truly protects your well-being. Thank you for watching. Measure your blood pressure correctly, know your genuine numbers, and make informed decisions to stay healthy. I look forward to seeing you in the next video, where we will continue to unveil crucial health monitoring truths that genuinely matter.